Welcome, curious minds, to vpod.ai's Deep Dive. Today, we're plunging into a topic that might genuinely surprise many of you. It's something maybe you didn't realize was a significant health concern: male breast cancer. Now, before we really dig into this fascinating and, frankly, crucial subject, just a quick word from our sponsor. This deep dive is brought to you by Stonefly. They're your trusted solution provider and advisor in enterprise storage, backup disaster recovery, hyper-converged VMware, Hyper-V Proxmox clusters, AI servers, SA365, which is a turnkey security appliance, and also public and private cloud. For more info, do check out stonefly.com. Okay, so let's get into it. When we talk about breast cancer, most people immediately think of women, right? It's almost automatic.
Exactly. That's the default image.
But the reality is, men can and do get breast cancer. And comes with its own unique set of challenges, its own complexities. For this deep dive, we've pulled together some pretty robust information. It sheds light on everything, really, from how surprisingly rare it is to the profound psychosocial impacts. Our mission today isn't just to list facts, though. It's more about uncovering why male breast cancer, even though it's rare, presents such a unique and often isolating challenge. We want to explore its, surprising biology, the specific struggles men face in getting diagnosed and treated, and maybe most importantly, the sort of human cost of a disease that's often hidden right there in plain sight.
Yeah, and what's really striking here, I think, is that while it is rare, like you said, less than 1% of all breast cancer cases, the incidence rate is actually, it's going up.
Going up, really?
Yeah, and this isn't just a statistical blip, It highlights a growing, yet often ignored public health challenge that really demands our attention. Maybe it suggests, evolving environmental factors or perhaps just better diagnostic vigilance. We're getting better at spotting it. So the core question we're tackling today is, what does it truly mean to be a man with breast cancer in a world that largely overlooks you? And, maybe more practically, how can we better prepare ourselves and society for this reality?
Okay, so with that surprising increase you mentioned in mind, how rare are we actually talking? What are the numbers really for male breast cancer? And has that picture changed much over time?
Right, good question. It's estimated at about 1.2 cases per 100,000 men each year. And like I said, that number reflects an ongoing increase. If you look back, say, between 1975 and 2015, the incidence in men actually jumped by 40%.
40%? Wow.
Yeah, it's significant. It typically shows up in men between 60 and 70. That's the peak age range, though it's important to stress it can happen at any age. And the most common type, overwhelmingly, is something called invasive ductal carcinoma.
Invasive ductal carcinoma. What does that mean exactly?
So basically, it means the cancer cells started in the milk ducts. Yes, men have them too, just less developed, and then they've spread into the surrounding breast tissue. That type makes up about 90% of all male breast cancers.
90%. Okay, so a 40% increase over those decades is, that's pretty striking. What exactly then increases a man's risk for developing this? Are there specific genetic things or maybe environmental factors we should know about?
Well, connecting this to the bigger picture, the risk factors do vary, but some definitely stand out. Genetic mutations are a big one, especially in the BRCA2 gene.
BRCA2. I've heard of that in relation to women's breast cancer.
Exactly. It normally helps repair damaged DNA and suppress tumors. When it's mutated, that protection is lost. It's thought to be responsible for maybe 5% to 10% of male cases. Another really notable risk factor is something called Klinefelter syndrome. This is a genetic disorder where males are born with an extra X chromosome, so XXY instead of XY.
Okay.
And having Klinefelter increases the risk of breast cancer like 20 to 30 times compared to the general male population. It's a huge difference.
20 to 30 times.
Oh.
That's incredible. So that covers specific genetic conditions. What about other things, maybe less obvious factors that might surprise people?
Yeah, there are others. We also see links to hormonal imbalances. So, for instance, conditions like liver disease, particularly cirrhosis, or even just obesity can lead to higher estrogen levels in a man's body.
Higher estrogen.
Yep. And that increased estrogen bumps up the risk. Also, past radiation therapy to the chest area, maybe for treating something else years ago, that's another factor. And interestingly, some research suggests certain jobs, like those involving really hot environments or maybe exposure to petrol and exhaust fumes, might be associated with an increased risk too. Though it's fair to say these occupational links don't point to a large, easily identifiable high-risk group. It's not like we can screen based on job title easily.
Right.
Which kind of leads us to think, how do we identify those men at highest risk for earlier detection, especially when a lot of these factors aren't things you can easily screen for in the general population?
That's a really crucial question, especially about early detection.
Hmm.
So moving on from understanding the risks, what happens if symptoms do appear? Given how rare it is, and you said it's often painless,
Yeah.
how is male breast cancer typically diagnosed? What signs should someone, or maybe their partner or family, look out for?
Well, usually the first thing a man notices is a lump, a palpable lump, or maybe a thickening, either in or near the breast, or sometimes in the underarm area.
Just a lump.
Often, yes, but it's not always just a lump. Other signs can include changes to the skin over the breast, like dimpling or puckering, maybe scaling, or even color changes. Another really important sign is if the nipple starts to turn inward or if there's discharge from the nipple, especially if it's bloody discharge. That's a definite red flag.
Oh, okay.
So diagnosis usually starts with a physical exam by a doctor, what's called a clinical breast exam. Then they'll likely move to imaging tests, maybe a mammogram, which, yes, men can have too, or an ultrasound, sometimes an MRI. But the definitive diagnosis always comes from a biopsy.
With a biopsy.
Yeah. They take a small tissue sample from the suspicious area and look at it under a microscope. That's the only way to know for sure if it's cancer.
So once that biopsy confirms it,
Yeah.
it is cancer. How do doctors figure out the best way to treat it? What's the next step in sort of tailoring that treatment plan?
Right. So a key part of figuring that out, of classifying the cancer, involves testing the tumor sample for a couple of things. One is estrogen and progesterone receptors, ER and PR. Think of them like docking stations on the cancer cells that hormones can attach to, and fuel growth.
Okay.
And the other thing they test for is a protein called HER2, which is another thing that can promote cancer cell growth.
HER2.
Got it. So if a tumor tests positive for ER or PR, it means hormone therapy is likely to be a really effective treatment option. If it tests positive for HER2, then we have specific targeted therapies that are designed to block that particular protein. After that, the standard staging process kicks in. That's where they figure out how far the cancer has spread. And actually, that process is pretty similar to the one used for women, even though we know there are biological differences in the disease itself between men and women.
Okay, so staging is similar. What about the main treatments then? Is it just like for women, surgery, chemo, radiation, hormones? Or are there significant differences in how men are actually treated, given those, unique biological points you mentioned?
Well, broadly speaking, the treatment avenues are similar. Like female breast cancer, treatment often involves surgery. Most commonly, that's a mastectomy, the removal of the breast tissue.
A full mastectomy.
Usually, yes. Though sometimes, for less aggressive, smaller tumors, breast-conserving surgery might be an option. Then you have radiotherapy, chemotherapy, and hormone therapy. Those are all key components too. But here's the thing. Historically, the specific treatment guidelines for men have largely just been, extrapolated from the ones developed for women.
Just copied over, basically.
Pretty much. Which naturally raises a really important question about how well they actually apply. Are we truly treating men in the most effective way by simply adapting women's protocols? Or do we really need male-specific strategies based on their biology? It's a big question in the field right now.
Yeah. That's a critical point to consider. So, okay, turning to the treatments themselves. Chemotherapy often comes up first in people's minds. I'm genuinely curious, though, are there particular things to think about or approaches that are unique when giving chemo to men with breast cancer, like different drug sensitivities or side effects that really stand out?
Chemotherapy, yeah, it involves these powerful cancer-killing drugs. They're usually given intravenously, sometimes orally. And it can be used in a couple of ways. Sometimes it's used adjuvantly.
Adjuvantly?
Meaning after surgery. The idea is to target any microscopic cancer cells that might have escaped and could be lurking elsewhere in the body. Or it can be used neoadjuvantly, that's before surgery, to try and shrink the tumor, maybe make it easier to remove completely. And of course, it's also the main treatment if the cancer is advanced, if it's already spread widely. Now, common drug combinations often include powerful agents from classes like anthracyclines and taxanes. These are pretty aggressive drugs that target fast-dividing cells, which includes cancer cells. Doctors usually give these in cycles, maybe every 2 or 3 weeks, for a total of about 3 to 6 months, typically. There's also something called dose-dense chemotherapy.
Dose-dense?
Yeah, where the cycles are given closer together, maybe every 2 weeks instead of 3. Some studies suggest this might lower the chance of recurrence and improve survival for some patients. But the downside is it can also make the side effects more intense.
Right, side effects. Chemo sounds incredibly intense. What kind of side effects can men typically expect? And are there particular concerns or maybe differences compared to what we often hear about for women?
Yeah, it is intense because chemo attacks all fast-dividing cells, not just cancer cells. It leads to those common side effects we hear about: hair loss, mouth sores, nausea, vomiting, fatigue, and importantly, low blood cell counts. That can increase the risk of infections, bleeding, and anemia.
Okay.
Beyond those, there can be more specific side effects. For example, nerve damage, what we call peripheral neuropathy, especially with the taxane drugs. That can cause tingling, numbness, or pain in the hands and feet. And with certain drugs like doxorubicin, which is an anthracycline, there's a risk of heart damage. So heart function needs careful monitoring during and after treatment.
That damage too. Wait.
Yeah. And then there's the whole phenomenon of chemo brain. That's, problems with concentration, memory, feeling foggy. While most of the research on chemo brain has been done in women, there's no reason to think it doesn't affect men similarly. It's a real and often frustrating side effect.
Okay. Now, you mentioned earlier that most male breast cancers are hormone sensitive, ER positive. So hormone therapy must be crucial, right? Tamoxifen has been the standard for ages, but I feel like I've heard some discussion that maybe it's not a perfect fit for men, maybe due to side effects or biology.
Yeah.
Can you expand on that? How is it different from women's experiences?
You're asking a really, really important question there. Yes, tamoxifen is effective. Biologically, it works. But it comes with a pretty significant burden of side effects for men. Things like reduced libido, weight gain, hot flashes, mood swings, even risk of blood clots.
The similar side effects to women, but maybe experienced differently or have different impacts.
Exactly. And the impact is often profound enough that it leads to what we call non-adherence. Basically, men stopping the treatment. Studies show over 20% of men stop taking tamoxifen within a year. That's compared to maybe 10% of women.
Double the rate. Wow.
Yeah. And here's where it gets even more complex. There's another class of hormone drugs called aromatase inhibitors, or AIs. They are very effective in postmenopausal women because they block estrogen production in fat tissue, which is the main source after menopause.
Right.
But AIs have shown less benefit in men when used alone. Why? Because men have two main sources of estrogen. About 80% comes from the conversion of testosterone in fatty tissues, which AIs do block, but the other 20% comes directly from the testes, and AIs don't touch that.
Ah, I see. The testes keep producing it.
Precisely. So, if you're going to use an AI in a man, you often need to combine it with another drug, something called a GnRH analog. This medication basically shuts down testicular function, stopping both testosterone and that direct estrogen production.
So double the drugs, potentially double the side effects.
Oh, certainly different side effects, and yes, potentially worse overall impact on quality of life. Shutting down testicular function can unfortunately worsen sexual dysfunction, cause bone loss, and other issues. It's a difficult trade-off.
That's a critical distinction. That dual source of estrogen in men really changes the hormone therapy picture.
Yeah.
So given these complexities with tamoxifen adherence and the issues with AIs, what does this mean for the future? Are new approaches being looked at specifically for these male challenges?
Yes, absolutely. This leads us to a really crucial area of ongoing research. There's a major clinical trial underway called the ETHAN trial.
Ethan.
Yes, ETHAN. It's a multi-center phase 2 randomized study. And it's directly comparing standard tamoxifen against anastrozole, that's one of the AIs, with or without dagarelix, which is one of those GnRH analogs that blocks testosterone production.
Okay, so comparing different hormone strategies head to head.
Exactly. And it's also evaluating adding another type of drug called abemaciclib. This is a CDK46 inhibitor, a newer class of targeted therapy that's shown promise in female breast cancer.
So trying combinations too.
Right. The hope is really to identify more effective options that maybe come with fewer of those debilitating side effects than tamoxifen alone, or the AI plus GnRH combo. And a key point here is that many of these drugs, the AIs, the GnRH analogs, are often already available as generics. So if they prove effective and safer, they could be quite accessible.
That sounds like a genuinely significant development.
Yeah.
Okay, what about the third pillar, radiation therapy? When does that come into the picture for men? Are there specific things to consider there as well?
Right, radiation. So adjuvant radiation therapy, meaning radiation given after surgery, usually after a mastectomy, its exact role is still debated sometimes. However, the evidence we have strongly suggests it significantly improves local control. It reduces the chances of the cancer coming back in the chest area.
Especially in certain cases.
Yes, especially for men who have positive lymph nodes, meaning the cancer has spread to the lymph nodes under the arm. And here's a key statistic. About 50% of male breast cancer cases do present with nodal involvement at diagnosis.
Half of them. Wow, that's high.
It is, and it reflects the fact that men are often diagnosed at a more advanced stage than women, unfortunately. So, given that high rate of nodal involvement and the later stage diagnosis, radiation therapy is often considered mandatory in many situations, particularly after a partial mastectomy or any time lymph nodes are involved after a full mastectomy. It's really a vital tool in trying to prevent the cancer from returning locally.
Okay. Now, beyond all the purely medical aspects, the surgery, the chemo, the radiation, the hormone therapy, what really stands out from the information we looked at is the profound psychosocial impact of male breast cancer. You touched on it earlier, but this idea of it being seen as a female disease, I just imagine that creates such a unique and isolating set of challenges for men who are navigating this diagnosis.
Oh, absolutely. It's huge. The perception of breast cancer as exclusively a female disease creates this massive societal blind spot. It means men often end up battling this disease feeling incredibly isolated. They face a kind of double burden, dealing with the cancer itself, which is hard enough, and then dealing with the profound lack of tailored information, understanding, and support. All because breast cancer is primarily and, mistakenly perceived as only affecting women.
So what does that look like day to day?
Well, men grapple with the physical changes, like trying to hide mastectomy scars, maybe feeling self-conscious about them. They deal with the visible side effects of chemo, like hair loss, which might feel different in a societal context for a man. And they frequently talk about feeling like their specific needs are overlooked. Treatment procedures, recovery advice, support groups, they're often primarily geared towards women's experiences.
Yeah, I can see that.
And all of this significantly impacts their quality of life. Which isn't just about physical health, right? It's that holistic mix of physical and psychological well-being. They're often left to navigate this incredibly tough journey feeling misunderstood, or worse, in silence.
That's a really stark reminder of those less visible burdens. What other quality of life issues do men specifically face? Maybe unique to their treatment paths or just how society views this disease in men?
Well, body image concerns, maybe surprisingly, play a really critical role. Men who undergo mastectomy often report significant negative psychological stress because of the surgical scars. It can lead to reduced self-esteem, maybe avoiding social situations, intimacy issues, even things like breast reconstruction. While technically available, it's inherently much harder to achieve a natural look for a man's chest. And sometimes the reconstruction itself can lead to its own set of psychosocial problems. They might feel even more self-conscious, not less.
That makes sense. What else?
Beyond body image, men seem to be more prone to developing lymphedema, that's the swelling, usually in the arm, caused by fluid buildup after lymph node removal or radiation. They also report difficulties with arm and shoulder mobility more often. But perhaps one of the most pervasive and difficult issues is sexual dysfunction. A study suggests over 70%, maybe even 71% of male patients experience some form of sexual dysfunction.
70%.
Yeah. And it's often persistent, especially while they're on endocrine therapy, the hormone treatments we talked about. Add to that the chronic fatigue that often comes with cancer treatment and the constant nagging fear of the cancer coming back. It's a heavy load.
Definitely.
And all this just underscores the critical need for male-specific psychosocial support, especially because the aftercare regimens often just mirror those for women, but sometimes come with unique side effects for men, like we mentioned the GnRH analogs causing accelerated bone loss. The importance of having support systems and resources that understand the male experience of breast cancer really cannot be overstated.
Wow, that was a truly insightful and I think really important deep dive into male breast cancer. It's so clear this isn't just some rare statistical footnote. It's a condition with unique biological drivers, and as you've really highlighted, profound, often overlooked psychosocial impacts for the men affected. We've certainly seen the critical need for more tailored research, better treatment strategies, and just more understanding and emotional support for men.
Indeed. And the drive for that awareness, for earlier detection, which is so key, and for developing these new male-specific therapies like the Ethan trial, is exploring it's all absolutely crucial. It really reminds us that knowledge is power, doesn't it? By understanding these nuances, we can hopefully push for better and more equitable care for every single person facing this diagnosis, regardless of their gender.
So what does this all mean for you listening? Well, perhaps it's a call to share this knowledge,
Yeah.
to advocate for greater awareness in your own circles. Or maybe just to understand that health challenges like this can affect anyone, regardless of the common perceptions or stereotypes. It kind of makes you ask, what more can we do as a society to ensure that men with breast cancer receive the comprehensive, the empathetic care they really need and deserve? How do we move beyond the stereotypes to truly see the individual going through this? We really hope this deep dive has given you a shortcut to being well-informed on this vital and often hidden topic. A big thank you again to Stonefly for sponsoring today's deep dive. Just a reminder, if you're looking for a robust and secure storage solution, Stonefly is offering a 100 TB immutable and air-gapped SSO NAS for just $8,995. You can find more details on that at stonefly.com. We'll be back soon with another deep dive into a new world of knowledge.